The Center for Health and Democracy is reporting some huge swings in the revenue and profit numbers coming out of the big for-profit health insurance companies in America. Back in 2012, for example, United Health Group received, where to go? 56%, I'm sorry, this is Anthem, 56% of their company's revenues came from private paying customers. Today it's only 27%. What's making up the difference? Well, it looks like it's these Medicare Advantage scam programs. Same thing with United Healthcare. In fact, United Healthcare has 35,000 fewer people in their individual and employee-sponsored plans today than they did in 2012, 10 years ago, but they have had 100% growth in their enrollment. What is it? Medicare Advantage scam. Susan Rogers, Dr. Susan Rogers, MD, a general internist and president of physicians for the National Health Program. PNHP.org is the website. PNHP on Twitter, or RGRSSSN is Dr. Susan Rogers' Twitter handle, is on the line with us. Dr. Rogers, welcome to the program. Tell us how we're doing here in this country right now with these attempts, particularly by Democrats in the House and Senate, to at least slow down this freight train that George W. Bush started when he popularized the privatization of Medicare, with the Medicare reforms in, what was it, 2003, 2005, whatever year it was, with this allowing them to use the term Medicare Advantage to describe just, a basic private health insurance program.
Well, things have clearly gotten worse, and they are continuing to get worse. And part of it is this belief that healthcare is a market and it is better served by private businesses versus the government. And that's entirely wrong. Healthcare is not a market. It doesn't function the way other markets do with other goods. It should be looked at as a public good and not being, delivered through private corporations that have a totally different mission, which is to make money. And they clearly are doing very well with their mission.
Is that because if I'm going out to buy a pair of jeans or a new sofa or, have dinner with my wife at a restaurant, these are all choices, whereas when I go to the doctor, it may well have to do with life or death, and I really don't have any choice. I have to deal with this or I die.
Exactly. And then, when we think about choice in healthcare, what is it that we really want to choose? We want to be able to choose our doctor, who we go see for our healthcare. We want to choose where we go for our healthcare, whether it's at a certain clinic or a hospital. Those are the choices, not a healthcare plan that we want. And you're right, when you are critically ill, you're sick, you need to go to the emergency room, you're not in a position to make choices. And even if you do have time to make a choice, let's say you need to have your gallbladder out, for example, and even if you call different hospitals to say how much does it cost, none of that is really accurate. And your eventual bill will probably be nothing like what they may propose, because right now it's based on what your insurance will pay, not what the hospital charges.
So back during the Trump administration, they rolled out this new, the Centers for Medicare Services, CMS, rolled out this new program to allow doctors and hospitals to shift people into Medicare Advantage programs, in some cases even without their knowing or without their permission. Some of them are opt-out rather than opt-in. And that the direct contracting entities, the DCEs, and DCEs kind of went, viral for a while there, starting maybe 6 months ago. And now it appears that the industry is coming up with new ways that people can get shifted into Medicare Advantage and out of traditional Medicare without their knowledge or consent.
Clearly, yes. And Medicare Advantage is a little bit different from the direct contracting entity because you can choose to go into a Medicare Advantage plan versus, or you choose to go into traditional Medicare. But the direct contract entity can align you into a plan based on your physician. Whoever your provider is, if they're a member of a DCE, they will align you with that doctor, and you will then be enrolled in the DCE. You don't even know it. You did not make that choice. So the DCEs are managed plans, and they're similar to how they function to Medicare Advantage, but I like to describe it as Medicare Advantage on performance enhancing drugs. They just are much more virulent in the terms of their aggressiveness in trying to make money, and the fact that you're enrolled and you don't even know it, which is really contrary to the choice that you have made. I personally have made a choice to be in traditional Medicare. I hope I'm not in a direct contracting entity now, but I could be placed in one and I wouldn't even know.
That's amazing. And you're a physician. We're talking with Dr. Susan Rogers, MD. And what is the state of attempts to push back on this? I'm frankly shocked and disappointed that the Biden administration hasn't taken some pretty aggressive steps to do something about this. Although I get it. These health insurance companies are multi-billion-dollar companies. This is a trillion-dollar marketplace. And, buying a politician these days is just, it's an investment of $2 or $3 million to really, really and truly own a politician. And if you're looking at $1 billion in profit, $2 million to buy off Ted Cruz or something is nothing. But I'm still disappointed that the Biden administration has not taken a more direct action against these people. Who is pushing back on this, and how is it going?
Well, Physicians for a National Health Program is definitely pushing back. In fact, we made a trip. There was a group of us, all physicians, one medical student who joined us too. We went to Washington, D.C., and we had a rally in front of the HHS building, and we presented a petition with over 250 signatures saying that we did not agree with the direct contracting entities that they proposed. And keep in mind, this was done by the Center for Medicare and Medicaid Innovation that was started. It was created under the Affordable Care Act, actually back in the Obama administration. And the way it was created, there was not any mandatory oversight. They can do whatever they want. Congress doesn't. When we talked to some Congress people, they were not even aware of this. And so all of this is done without any oversight, without any regulation. I mean, that's how it has to be if they can just sneak people into a program that they didn't choose.
Right. What is ACO REACH?
Well, ACO is Affordable Care Organizations, which are just groups of healthcare providers that are part of the managed care system where those providers and their patients are managed care. And the REACH is, God, I'm blanking on the eponym, but it's about equity and access, and it's just really a new name to the DCE program. It's just the same shirt, but a different color.
Yeah, so this was because everybody was getting all upset about DCEs, they just changed the name.
Exactly, that's all they did, and they made it a little bit more aggressive and predatory, but it's the same system.
Do you expect anything to change? I mean, have the Democrats broadly, if we could talk about the politics of this for just a moment here, and then I see a break coming up, so, but is there a broad movement within the Democratic Party to do something about it? I know we've got some politicians. I've got, Kurt Schrader here in Oregon, who's basically owned by the health industry, not wanting to do anything about this. He's a Democrat. But broadly, is the Democratic Party on board with doing something about this?
Unfortunately, no. And I think a lot of this is just related to how much influence lobbyists have and where campaign donations come from. But what we have done, though, is we have, talked to Congress people, and many of them have actually thought about it, and once they've learned about it, changed the way they think. But we've done some things that have been very successful. In Seattle, the Puget Sound Seniors Association, they had the city council pass a resolution against the DCEs. The Arizona Medical Society passed a solution against the DCE and the ACO REACH program. So there are social activist groups, including PNHP, that are working with areas, city councils, Congress people, medical societies, so that they are aware and they are becoming more active against this program. So it's beyond just providers. It's part of the social activism in this country.
Beyond just going just going to PNHP.org, which I strongly encourage people to do, and chip in and support the extraordinary work you folks are doing and have been doing for years.
Thank you.
I keynoted your Seattle conference 15 years ago, I think it was. I have great affection for PNHP. But beyond that, what should people say when they call their member of Congress, and how can people most directly, people who are concerned about this and the future of Medicare itself, because it seems to me that, they're at about 50% now privatized Medicare. When they hit 60 or 70%, they're just going to say, okay, that's it, screw it, we're going to pull the plug, no more Medicare. And that could happen in the next 2 or 3 years.
That's quite frightening.
I don't want to see that happen. What can the average person do?
Okay, let me give you a couple of websites that you can go to. One is protectmedicare.net/register, and then you can get to our website, and you can also sign on to our petition.
Okay.
There's another site, protectmedicare.net/May 9th, which will be a roundtable discussion with 3 expert physicians who will talk about how this new program will not address equity, and also talk more about the risk of the ACO REACH program. And on May 23rd, PNHP is sponsoring a workshop which will teach you and give you a toolkit of how you can become more active and knowledgeable in fighting the ACO REACH program.
Okay, great. Thank you. Dr. Susan Rogers,
thank you
so much for being with us.
Thank you for asking me.
My pleasure. And PNHP.org as well, and PNHP on Twitter.